Hi guys, hope I'm audible and visible to you. I just need your quick response on the chat box so that we'll be proceeding with Biochemistry, Dental Anatomy Part 2 paper discussion, which is basically continuation of yesterday's class. I just need your response on the chat box as quick as possible. Hi guys, I just need your response as early as possible. Yeah, hi Lokeshwari. Please do join as early as possible so that we'll start the. Yeah, Jessica is back. I think today we will take around like 1 hour. We'll try to finish it so that you can go back to your schedules of your CVS. Yeah, good evening, Pallavi. Good evening, Roy. Good evening, Jagadishwari. Aditya, good evening. So yesterday we are done with question number 50 and today we'll be continuing that. And wherever concepts are required, I'll try to discuss that integrated concepts. And of course, as already mentioned in yesterday's video, so we are starting a midterm online batch from September 21st. Okay, if you need any details regarding this, you can just drop a message on the helpline number. That is 9966939317 on the WhatsApp. We can discuss, plan accordingly, and we'll try to help you in your preparation phase. Okay, without wasting any time, shall we start? As of now, 40-45 plus, not bad. Okay, so I want to start. I just need a thumbs up from all of you on the chat box so that without wasting any time, I'll try to finish these leftover 50 questions as quick as possible in the most integrated manner. Okay, right. So coming to question number 51, a patient is with gout, is treated with allopurinol, and the drug is structural analog of hypoxanthine, and it inhibits which of the following enzyme is the question. The question is basing upon the enzyme chapter in the biochemistry, and of course it is integrated to your pharmacology. So I told you, right, when I'm talking about general pharma, I'll be telling you some more inhibitors. So that is where the integrated question has came from, and this is already an old repeat. Okay, so now most of us are aware how this gout is going to happen, and if you closely monitor, it is basically produced from the degradation of purines. Very frequently asked question. So purines are going to get breakdown. So purines are going to give this hypoxanthine. This hypoxanthine will be converted to xanthine, and the xanthine finally degraded to form this uric acid. So this uric acid will get accumulated in different areas, and it is going to cause this particular condition called as gout. And of course, most of you are aware, which is the most specific method of diagnosis of gout is presence of uric acid in the case of your synovial fluid and in the case of your joints is the most specific method for the diagnosis of this particular disease. Now, for conversion of this hypoxanthian to xanthian or xanthian to uric acid is basically mediated by an enzyme called as xanthium oxidase. And this xanthium oxidase is basically inhibited by this particular drug what we are discussing now. Okay, so xanthium oxidase will convert this into alloxanthium, and this alloxanthium is going to break down and inhibit this oxidase enzyme by inhibiting the conversion of hypo to xanthian and xanthian to uric acid, by which the uric acid formation will be minimized, and this is how the treatment is happening. Okay, the answer is xanthium oxidase, option B. Okay, so we are done with 51. Now I am jumping into 52. 52 concept is also discussed for you. Okay, I clearly told you, I have given a table in the structures of carbohydrates chapter, and I told you to go with all these structures which I have written down here. The question is, which of the following is an example of GAG that is primarily found in cornea and it is unique? And the most important thing is it does not contain urinic acid. If you go in detail into the compositions of all these options which are given for you in your notes, I want you to go back, check your notes. Hyaluronic acid is basically going to contain D-glucouronic acid, and it's going to contain N-acetyl glucosamide. Similarly, conductin sulfate is going to contain the same D-glucuronic acid plus N-acetyl galactosamine. It's going to contain, there it's going to contain glucosamine. This is going to contain galactosamine, and it's going to contain 4-sulfate. Similarly, heparin sulfate is going to contain D-glucuronic plus 2-sulfate and 6-sulfate. Okay, all these compositions are very, very important, and already the notes is given to you. Okay, so now the answer here is keratin sulfate. Keratin sulfate, of course, is present in cornea. It is present in all the C's, that is cornea, cartilage, and the connective tissue, and this helps in maintaining the transparency of cornea. And what it is going to contain? It's going to contain D-galactose, N-acetyl glucosamine, and 6-sulfate. So please, these chemical formulas are very, very important. Okay, very, very important. There are so many times the question has been repeated from this particular area, and it is already given as a notes in your workbook. Okay, so please go back and check out if you are not done properly. So please go back and check it, check this properly, and please do mark it. So this structural components has to be done from the structure of carbohydrates. I just need a thumbs up sign so that I'll be proceeding further. Straightforward, easy question. Essential amino acids. All of the following are essential amino acids, except, again, I have given a notes. Okay, and this mnemonics, all of these mnemonics are there in your PP books also. The answer is C. So just check out the classification part. Essential, non-essential amino acids are very, very frequently asked questions. Okay, if you check out this particular table, which is a direct notes of your power play books, essential amino acids, please do practice the same code. Whatever codes which you feel like you are comfortable, you can follow them. So this is what I have given. This is what I have prepared during my preparation phase. Essential are VIP, ML2T2 plus AH. AH are nothing but called as semi-essential amino acids. One starts with A, that is arginine for A, and second one is histidine. Why these are called as semi-essential amino acids? Because these are present in the adult. Okay, these are present in the adult, but they are not present in the child. So that is the reason why these are called as semi-essential amino acids. Okay, semi-essential amino acids. So the code for essential amino acids is VIP ML2T2 plus AH. Or you can remember any one of them, either semi-essential or you can remember either non-essential. Non-essential are also easy to remember. That is GASPCT. The code is GASPCT. So you try to remember any one of them for this particular classification. Okay, and you will get the answer. The question is, all of the following are essential, except they're asking which is non-essential, that is thyroxine is non-essential. Similarly, you have one more classification. Okay, you have one more classification, but this particular GT, you don't have a question on this particular classification, but if you're checking out the subject specific exam of biochemistry, you have a question on this classification. So basing upon the metabolism, okay, again, your amino acids are being divided into three types. One is ketogenic, that is your KL2, where L for leucine, L for lysine. The second one is both ketogenic and glucogenic, where the code is PITT. And the last one is glycogenic, the rest are. Okay, you can remember these two, and the leftover amino acids will be come under glucogenic. Okay, so this is very, very important. KL2 and PITT, the code is. KL2 is very easy to remember. Ketogenic, both of them are going to start with L, that is one is leucine and lysine. Okay, right? I hope this is done. Okay, right? Next comes, again, you have a similar question which basing upon the catecholamine synthesis which we have discussed yesterday. The enzyme that is defect in phenylketonuria is your phenylalanine hydroxylase. This is what I have discussed. Can anyone tell me what is the coenzyme which is activating this phenylalanine hydroxylase that we have discussed? That is BH4. That is BH4. Okay, right? So 54, I am done. I'm moving to the next question, 55. Cherry red spots with hepatosplenomegaly. Cherry red spots with hepatosplenomegaly. And I clearly told cherry red spots are seen in two lysosomal storage diseases, which we have discussed in our class. The first lysosomal storage disease is Niemann-Pick disease, and the second lysosomal storage disease is Tay-Sachs. The first one is Niemann-Pick, and the second one is Tay-Sachs. Okay, and I clearly mentioned, okay, your Niemann-Pick and Tay-Sachs are differentiated by hepatosplenomegaly. Hepatosplenomegaly is present in the case of your Niemann-Pick. It is present here. Okay, it is absent in the case of your Tay-Sachs. And the answer for this particular question is option B. Okay, again, everything was discussed in your regular classes. It is done in your live classes, okay, and as well as in the offline. And I hope you guys have marked this right. Then jumping into maple syrup urine disease. Again, maple syrup urine disease has been discussed with you. So maple syrup urine disease, they're talking about the vitamin supplement that is required. The vitamin supplement that is required is thiamine. Okay, the answer is B1. Okay, if you go in detail, a very, very important thing, the same slide I have kept here. So you can assume that the maple syrup urine disease, that is MSUD, is basically associated with a complex called as BCKD, that is your branched chain alpha keto dehydrogenase. Alpha keto dehydrogenase, very, very important, alpha keto dehydrogenase. And I told you, you can remember it as branched chain amino acids. Okay, and in discussion part we have covered branched chain amino acids are basically going to start with, you see trees there. Tree is going to give us oxygen with which we are living. So you can remember this branched chain amino acids starts with the letter LIV. Okay, that's L for leucine, I for isoleucine, and V for valine. So these are the branched chain amino acids in this particular maple syrup urine disease. What complex it is mediating? The complex that is mediating is branched chain alpha keto acid dehydrogenase. Acid dehydrogenase. So this is the enzyme which is responsible, deficient in the case of your MSUD. The next comes after 5 days without food. Normally, you take food, glucose is going to come with which we are going to maintain our daily activities. Whenever we are not taking food, whenever we are in the state of starvation, which particular contents or which particular ingredients are going to help us in maintaining the body activity or in maintaining the brain activity particularly? That is your ketone bodies. Okay, so after 5 days of starvation without food, the main source of brain is by ketone bodies, that is called as ketosis. Ketone bodies, that is called as ketosis. Okay, so I'm done with 57. Okay, then I'm moving to 58. 58 question is again a straightforward vitamin based questions. Vitamin which is required for carboxylation of glutamic acid residuals in the case of your clotting factors. The only vitamin which is dealing with clotting factors is vitamin K. And a very frequently asked question is vitamin K dependent clotting factors are 2, 7, 9, 10 and protein S and C. So protein S and C, 2, 7, 9, 10 clotting factors are associated with vitamin K, and the answer is vitamin K. Okay, right. I'm moving ahead. A question is straightforward and easy. So you have a oral path and oral medicine question. Dentigerous cyst arises basically from the unerupted teeth. Unerupted teeth is the most common etiology for occurrence of dentigerous cyst. A cumulative based question was given in this particular part, and I hope this is easy, that most of you can handle this. Okay, then comes question number 60. So question number 60 again is straightforward easy question. Here I want you to make a note about two important grooves that most of us are aware. One is mesial marginal groove. Mesial marginal groove. So one small groove will be there on the mesial side, and it is regularly given as a diagram based question. Mesial marginal groove is seen in the case of your mandibular first premolar, and mesial lingual groove is seen in the case of your mandibular first premolar. Now the question is mesial marginal groove. Mesial marginal groove, straightforward answer. The answer is maxillary first premolar, option B. Straightforward question. And this question, this groove based question was so many times given in NEET examination. The next comes 61. Immunoassay performed in HIV to detect the presence of antibody to identify a viral protein. So the concept is to identify a viral protein. And whenever you are checking the options, like for example, you have PCR here. PCR is not identifying the protein, it is identifying the nucleic acid. Particularly now I'm talking about HIV. So it is identifying the nucleic acid that is associated with HIV, RNA. Okay. And similarly, this is also associated with nucleic acid, that is nucleic acid sequence. Okay. And AS is a nucleic acid sequence. So both option A and option D are talking about the nucleic acid, whereas your option B and option C are talking about the protein or the antibody. Okay. So it has to be either option B or option C. And you know, the confirmatory test for HIV is your Western blotting technique. Okay. Regular test is ELISA test, but confirmatory test is Western blotting. And of course, in the regular classes, I have discussed very important aspects. What is that? I told you Western bottling technique, Western blot technique. I told you Western people are going to eat more pork. So that is your protein. Whenever they're asking for the detection of protein, your answer is Western blotting technique. Then I told you, okay, Northern blotting technique is basically helpful in the detection of RNA. I told North Indians, they more eat our roti. And then there is one more that is called a Southern blotting technique that helps in detection of DNA. Again, in the classes, I told, very easy to remember, South Indians, they eat dosa. Okay, right. So this question is an application based question on that particular topic what we have discussed. So answer for this particular question is option C, without any doubt. Then I'm jumping into the next one, 62, straightforward, easy diagram based question in the worksheets, in the workbook of dental anatomy. I tried my best to include each and every diagram from your Wheelers. Okay, because again, when you are approaching towards the exam, I feel it is very difficult for you to go back, keep a mark on the Wheelers. It's go back, keep, okay, maybe people who are taking the exam for the second time or third time are well aware of these things because they don't want to miss anything. But people who are doing it for first time, or let it be an intern or a clinician who is handling the clinic, or who is working in the clinic, or a mother who is having kids, it's very impossible to keep a check and go back to Wheeler's textbook, go back to Wheeler's soft copy. Doing all these things is going to be hypothetically not possible. So keeping that in mind, I tried my best to include all the diagrams of Wheeler's, all the diagrams which were given in the previous examinations of your dental anatomy, in your dental anatomy worksheet in the last 10-15 pages, so that you are not going to miss them. Okay, so this is a straightforward occlusal surface of the mandibular first molar, where you can see buccal side, you can see 3 cusps, 1, 2, 3, and lingual side you can see 2 cusps. So this is a occlusal surface of mandibular first premolar. Okay, right. So the answer is option A. Jumping into 63. Yeah, 63 is again a very straightforward, easy question. Okay, so they are showing lateral incisor, and we know lateral incisor is most commonly associated with an anomaly called as palato-gingival groove. If you just have a keen look, so you can see a palato-gingival groove which is present on the palatal side. So palato-gingival groove is most commonly associated with maxillary lateral, and similarly lateral abscesses are also very commonly seen in the case of maxillary lateral incisor. So this is a palato-gingival groove, and this palato-gingival groove is one of the contributing factor for the occurrence of endoperio lesion. As this is a palato-gingival groove, okay, so mostly in majority of the situations, initially it is originated as a gateway for the bacteria to transfer. So this is going to be primary perio. So periodontal problems will be started initially because of the palato-gingival groove, and further which it extends from the lateral canals or the accessory canals to infect the pulp. So it is primary perio and secondary endodontic lesion. Okay, right. So primary perio, secondary endodontic lesion, palato-gingival groove. So we have discussed mesial marginal groove, which is present in the case of your maxillary first premolar, mesiolingual groove, which is present in the case of your mandibular first premolar, palato-gingival groove, which is present in the case of your maxillary lateral incisor. Okay, I hope this is simple and clear, straightforward question. So I'm moving into question number 64. 64, again a very frequently asked question. Okay, again a very frequently asked question about this patterns of cuspal arrangement. Okay, nice diagram based question. Again, this is given in your worksheets. So this is what the type of classes of tooth forms. Okay, so first one is the oldest one. The oldest one is called as haplodont, which is seen in the case of reptiles, particularly crocodiles and all these things. I don't know how many of you watched crocodiles' teeth. As a dentist, we always have to look into the teeth of any pet or any dentition wherever you go. So this is called as haplodont, reptilian teeth, and this is seen in the case of crocodiles. You can see that it is seen in the crocodiles. So there will be only hinge movement will be there. So crocodiles are going to eat like this. Hinge movement will be there. Then the second one is called as trichonodont, which is most commonly seen in the case of early mammals. And this trichonodont is going to have 3 cusps. You can see nicely 3 cusps are there arranged one on another. And the central one is the largest cusp. You can see the central one is the largest one. And on either side, you are going to have the smallest cusp. This is called as trichonodont. And the most advanced tooth formation is going to be trituberculodont. So the most advanced is trituberculodont. And the last one is quadrituberculodont. Now the question is trituberculodont is the question which is given. The answer is option C. So with which we are done with question number 64 and moving to question number 65. Question number 65 is straightforward diagram based questions. All these diagrams were discussed by Divya ma'am. Okay, so all these diagrams are discussed by Divya ma'am. So they're talking about the oblique ridge. Oblique ridge connection is again a question which is given in the same paper. Okay, oblique ridge starts from the distobuccal cusp to the mesolingual cusp. Distobuccal cusp, mesolingual cusp together is going to form oblique ridge. The answer is option B. Then jumping into the tooth morphology based question, like they can give any side and they can ask us to identify. Okay, so coming to question number 66. Question number 66 is very simple. Here you can see a groove. So this groove is called as mesial marginal groove, which is present in the case of your maxillary first premolar. The answer is option A. Then comes, again they have given some anatomical abnormality. You can see an anatomical abnormality that is present. So that is called as dense abazinators. This is dense abazinators, straightforward question. Of course, integrated, so they can give anomalies also in the dental anatomy. Okay, so that is the question. Of which of the following permanent teeth is most difficult to distinguish between the mesial and the distal aspects? Okay, again, this is an application-based question. Regularly, they'll ask like which of the following incisor is basically or impossible to differentiate between left and right once it is extracted, because both the left side and right side, that is the mesial and the distal sides of these left and right mandibular central incisor, they look similar. So that is the reason why it is very, very difficult for us to differentiate these teeth, whereas other teeth we can easily differentiate. Okay, so now the question is, impossible to differentiate between the mesial aspect and the distal aspect is mandibular central incisor, option B. It is mandibular central incisor, option B. Okay, now you have a question on FDA system. The FDA system is a very frequently followed system of tooth numbering. So we have 4 tooth numbering systems which are discussed in the class. Okay, so make sure you go back and try to be perfect with each and every tooth numbering system, because these tooth numbering systems are a very genuine, basic, easy questions. You should not miss them. Now FDA system, they're asking 6-4, 5-4, 5th quadrant, 6th quadrant, 7th quadrant, 8th quadrant is primarily they're talking about the primary teeth. If it is permanent, it's going to be 1, 2, 3, 4 quadrants. Like how we call 1-6 your maxillary first molar, or 2-6 your maxillary first molar, 3-6 mandibular first molar, 4-6 mandibular first molar. Similarly, 5, 6, 7, 8 are talking about the primary dentition. And now the question is about 6-4. 6-4 is about the left quadrant, maxillary left quadrant. It is maxillary left quadrant, first molar. Okay, so it is primary maxillary left quadrant first molar. So you can see this is the first molar. 6-5 is second molar. Simple question, not straightforward and easy question. Now mandibular central incisor is symmetrical. I told you mandibular central incisor, left and right, mesial and the distal aspects are symmetrical, whereas lateral incisor, mandibular lateral incisor appears slightly to bend distally on the root. And what type of trait they are asking? So first of all, I think this is already covered by ma'am. Again, a repeat, which is already given in the last 5 years. If you take the star topic, it is there a star topic in dental anatomy. So if you check out, trait is a characteristic feature or a quality or identifying feature of a particular thing. Set traits are talking about permanent and primary, deciduous dentition, as well as set. They're talking about set, a particular set, primary set and permanent set. Second one is arch. Arch, they're talking about the maxillary arch, mandibular arch. Third one, they're talking about the class. Class is different types of teeth. You have incisors, you have canines, you have premolars, you have molars. And the last one is type. Type means, for example, you have incisors, you have 2 types of incisors. One is central incisor, second one is lateral incisor. You have premolars. One is first premolar, second premolar. You have molars. One is first molar, second molar, and third molars. They're talking about type. Okay. So now this is type they're asking. Okay. That they're talking about mandibular central incisor and mandibular lateral incisor. 70 question. The option is C. 70 question. The option is C. Guys, we are done with first 20 questions of today. Anatomy is a little bit boring, accepted, but it is nice scoring subject in the exam, because most of your questions in dental anatomy are going to be straightforward one, and most of the questions in dental anatomy or subject of dental anatomy can be done in a reading of 25 to 30 hours. 25 to 30 hours, you're doing a reading of a subject, and you can revise this subject easily if you do this subject from a proper source. Okay, I just need a thumbs up sign from all of you. We are done with first 20 questions, so that I'll be proceeding with the leftover. Yeah, right. So then comes what is the resultant structure seen due to faulty fusion of lobes during the development of a tooth? It's basically they are asking the definition of fissures. Patent fissures, which are present on the occlusal surface of your molars and premolars. Okay. Sometimes pits will be present on anterior teeth also, but fissures are present mostly in the posterior teeth, that is your premolars and molars, and they are basically responsible for initiation of the dental caries. All your dental caries and everything are going to start in this pit and fissure area. Okay, so they are basically asking the definition of this pit and fissure. Okay, pit, they are asking basically asking the definition of fissure. Okay, so the answer for 71 is option C. Then comes a old repeat. Okay, what is this? Maxillary molar has trifurcations of root. Which furcation is close to the cervical line? They're asking. Cervical line, which furcation, which side furcation is close to the cervical line? They're asking, because again, in 2024 NEET examination, you have a question on furcation. How you are going to approach a particular direction of furcation. Clinically, how you are going to approach a particular zone of furcation, the question was given. I mean, dental anatomy integrated with perio, the question can be from dental anatomy integrated with perio. But now here the question is, which furcation of your maxillary molar is close to cervical line? Is the question here. So if you check out the furcations on the mesial side, the furcation is 3 millimeters above the cervical line. The furcation is 3 millimeters above the cervical line. And on the buccal side, it is 4 millimeters above the cervical line. On buccal, it is 4 millimeters above the cervical line. Just a second. Above the cervical line. And on the distal side, it is 5 millimeters above the cervical line. So this is what I told you to remember, MBD in my class. MBD, mesial, buccal and distal. So 3, 4, 5. So now the question is closest. Closest is going to be mesial side. Closest is going to be mesial side. Closest is going to be the mesial side furcation. Okay, very nice. So with which we are done with question number 72. And can anyone tell me bifurcations and trifurcations are most commonly seen in which of the following teeth? Bifurcations, trifurcations. Please guys, please do answer this. Bifurcations and trifurcations are most commonly seen in which of the following teeth? Bifurcations and trifurcations are seen in which of the following teeth? And that particular teeth is called as anagma of endodontics. That particular teeth is called as anagma of endodontics. What is the teeth? Anyone? So please write down. So that particular teeth is called as mandibular first premolar. Mandibular first premolar. It's going to contain lots of bifurcations and trifurcations, which is difficult to get handled by the endodontist. So that is called as anagma of endodontics. Yeah, just give me a second. Guys, hope I'm audible, visible to you. Just a disturbance in the connection. I'm back. So jumping into question number 73. Again, types of occlusions I have discussed. So smart video is given by me. So particularly I was more focusing on canine guided occlusion and group functional occlusion. So during lateral contact movements of the mandible, the contact was noted between maxillary canine, premolar, molar, against the opposite canine, premolar and molar. Okay, so against the premolar and molar, and it is simply telling that a group of teeth are getting contacted from the two opposing teeth. So that is called as group functional occlusion. Next, they're talking about the contact points of your maxillary canine. Okay, it's not the straightforward question, but a similar question was given in NEET 2024. So this question can be an anatomy question or can be a smile designing question also, because building the contact points is a concept of your operative dentistry. Okay, so that can be coming under the smile designing, the question part also. And I have clearly mentioned in my notes, now I am talking about only 3 teeth, but I clearly mentioned the note about the contact. So all the teeth contact points are very, very important. So because they are going to maintain that integrity of periodontium as well as the aesthetics in the oral cavity. So maxillary central to maxillary central means on the mesial side. On the mesial side, the contact point is in the middle incisal 1/3, and on the distal side, that is contacting with the mesial side of the lateral incisor. So it is going to be on the junction of incisal and middle 1/3. So it is going to be on the distal side, is going to be junction of incisal and middle 1/3. Lateral incisor on the mesial side, it is junction of incisal and middle 1/3, and lateral incisor on the distal side, it is middle 1/3. Canine on the mesial side, it is junction of incisal 1/3 and middle 1/3, and canine on the distal side is going to be middle 1/3. Now the question is, okay, you check out the question. They are asking the mesial contact point. The mesial contact point is the junction of incisal 1/3 and distal 1/3. The junction of incisal 1/3 and distal 1/3, that is option D. So this concept is going to come under your smile designing part. So there is one more important question on the smile designing part, which is very frequently repeated. If you take the ratio between the length and width ratio, we know that the length will be more. If we take length value and the width value of a particular teeth, particularly anterior teeth, how much percentage it's going to be? Ratio or percentage? Anyone? Length and width ratio according to the smile designing. It can be an ortho question or operative question or a dental anatomy question. Because you have this lengths and widths dimensions and everything of a particular teeth, the length and width ratio is going to be, it is going to be 70 to 80%. It is going to be 70 to 80%. The question was repeated so many times in the examination. So please do make a note of it. So contact points are very, very important. So you have 2 questions on contact points, which are simple and straightforward, nothing to break your head. So now I'm jumping into question number 75. Question number 75 is the number of line angles and point angles in anterior. Line angles, point angles question was given. So line angles, point angles, again I have given a table for you. So line angles and point angles of all the classes as well as anterior teeth and the posterior teeth. So I hope you have done this particular question. Question number 75 is a straightforward question. The answer is option D. That is 6 and 8. This is what I was talking about. Okay, so I have given the line angles and point angles, okay, for all the classes of GV blacks 1, 2, 3, 4, 5, and followed by anterior and posterior teeth. Line angles and point angles along with this particular table are included in your worksheets, and I hope you guys have done it. The question is about the line angles in the anterior and the posterior. The answer is 6 and 8. I hope this is very, very clear. Okay, right. So then FDA system question was already given. Now the question is on ADA. So numbering systems are very important. FDA, ADA, WHO, and vectors numbering system, positive 04, negative 04, or normal 4. So this is what we have discussed. And this numbering system starts from 1 to 8, 9 to 16, 17 to 24, and 25 to 32. The question is about 24. And this is the left side, we know. 24 and 25 are nothing but mandibular central left Mandibular central right. So the question is lower mandibular central left. Lower mandibular, lower left central incisor. The answer is 75. The answer is option B. Answer is option B. Coming to 77 question, again a question of dental anatomy integrated with endo. Basically in anatomy, we don't talk much about the internal anatomy. Internal anatomy we don't cover in, of course it has to be covered in dental anatomy, but whenever we are teaching, we try to focus more on the external anatomy, but we don't talk about internal anatomy because internal anatomy is basically handled by an endodontist. So the question is, an endodontist is performing a root canal therapy on a permanent maxillary first molar. So permanent maxillary first molar. And I hope most of the clinicians who are working on the cases, you see, most of the failed cases will be of maxillary first molar. And we know that the maxillary first molar case is failed because of missing of MB2. It's very difficult to identify MB2 with the naked eye. A skillful endodontist associated with dental operating microscope can identify this MB2. And if we check out the how many cases out of 100, if 100 cases of maxillary first molar are given to you, okay, with the help of microscope, dental operating microscope, in around 95% of cases you can find MB2, but normally you see a regular endo work, you don't find this MB2 in majority of the situations. Since she is very experienced and working under dental operating microscope, she should look for the fourth canal. And where do you find this fourth canal, or in which route you regularly find two canals is the question. The answer is MB1 and MB2 are found in mesobuccal root. So mesobuccal root, option C, it's going to contain both MB1 as well as MB2, which is a part of your dental anatomy, internal anatomy linked to endo. Then comes question number 78. Again, a straightforward, very easy question. So we have discussed in the notes about different types of curves, and this particular concept is a part of your complete denture also in your prosthetics. So now they are asking which is called as anterior posterior curve. The first one is called as anterior posterior curve, that is called as curve of Spee. If you want, you can write down the radius of this curve of Spee. The radius of this curve of Spee is going to be 4 inches 10 centimeters, 4 inches or 10 centimeters. Straightforward question. The answer is option A, 78. The answer is option A. 79. Which primary teeth is commonly retained and leading to impaction of its permanent? The most common impacted primary teeth is going to be your mandibular second molar, or regularly asked question, most common ankylosed primary teeth. Ankylosis of primary teeth, which primary teeth undergoes ankylosis? The answer is mandibular second molar. The answer is mandibular second molar. 79. I am done. I'm jumping into question number 80. Cusp of Carabelli, very frequently asked question. So this is a very common finding in the case of your maxillary molars. Okay. So for example, cusp of Carabelli is seen in the case of your two teeth. One teeth is primary teeth. So in primary teeth, it is most commonly seen in the case of your maxillary second molar. The second one is permanent teeth. In permanent teeth, it is most commonly seen in the case of maxillary first molar. Now they have not mentioned whether it is a primary or a permanent, so you have to take permanent into consideration. Cusp of Carabelli is a non-functional cusp found on which of the following teeth? The answer is mandibular first premolar, option B. So this is the extra cusp which you can see in the mandibular, in the maxillary first molar. So this is the extra cusp I was talking about. If you want to write a little notes about this, this is basically the fifth cusp and the smallest cusp in the case of your maxillary molars. And the location it is present lingual to that of the mesolingual cusp of the maxillary molar. Location is lingual to mesolingual. Location is lingual to mesolingual. Okay, right? So I'm done with question till 80. I just need a thumbs up. 50 plus 55, 60 odd students are there. So I need a thumbs up sign from you. So we are left over with 20 more questions. I'll be finishing this off, and you can go back to your regular discussion part of your CBS. I hope like most of you have started CBS. Yes, I got Yes, Lokeshwari, Aarti, Shraddha is there. Roy is there. Jagadishwari is there. Aditya, Bhavana, Jessica, Navya. Any more? Yes, Maheshwari. Okay. The next comes is the contact points. Again, a question on contact points. So I want you to mark the areas. Contact points are something you have to revise them again and again. Mesolingual inclinations, buccolingual angulations, mesolingual inclinations. Again, you have a table. I want you to check them again and again because these are completely memory based. So dental anatomy is a memory based subject, okay, which has to be addressed again and again, again and again, again and again. But sometimes the questions can be easy. Okay, check out this question. Contact area between the two central incisors. I'm talking about the mesial side. The mesial side is present in incisal 1/3. Option A, straightforward, easiest question in the contact points. So you need to build this contact points whenever they are lost to maintain the periodontium health as well as to maintain the aesthetics in the oral cavity. Then comes 82, again a straightforward, easy question, oblique ridge, connecting which of the following two cusps in the case of your maxillary first molar, that is mesolingual and distobuccal. That is option A, straightforward question, very happy and easy. Then comes the first permanent teeth to erupt into the oral cavity. So which permanent teeth erupts into the oral cavity first? So now I want you to answer this. First primary teeth to erupt into oral cavity. What is the first primary teeth erupt into oral cavity? And what is the first permanent teeth erupt into the oral cavities? Please do drop me, drop the answers on the chat box. Please do come to live. Drag your cursor button to this end, come to live. And people who are watching it as a recorded version, make sure keep it in 1.5x and watch it in the recorded version. You have multiple options in the YouTube. You can change the language also. You want to watch it in Hindi, you can watch it in Hindi. So primary teeth, the answer is mandibular incisors. Very good. So that is the reason why the most common natal neonatal teeth are also your mandibular incisors only. And the permanent teeth is your mandibular first molar. Permanent is your mandibular first molar. Okay, right. The answer is option B. Okay, now what is most common natal neonatal teeth? Most common natal neonatal teeth. The most common natal neonatal teeth also are your mandibular central incisors. Teeth which is difficult to differentiate whether it is a left or a right upon extraction, mandibular central incisors. Teeth which cannot be differentiated, it's mesial and distal side, again your mandibular central incisors. Okay, chalo, you have one more question. Again, OPG based questions in the exam and asking you to identify the age of a particular child is a very, very frequently asked question. Okay, very, very frequently asked question. If we check out this, they're given a mixed dentition, they're asking the OPG. So if you closely monitor this OPG, I have given the eruption sequence because I myself only have discussed the eruption sequence. I hope you have done it well. So here the key things that you have to identify is the permanent teeth. So you have nice permanent teeth. And now we have discussed at what age the first permanent teeth that erupts into the oral cavity is the permanent mandibular first molar that most of you have answered. Now tell me at what age the eruption happens. What is the age of eruption of your mandibular first molar, which is already there in the OPG. Nicely they have erupted into the OPG and you can see buds of other teeth. So lots of buds. Mandible is very clear. So buds of other teeth are there. Yes, perfectly right. We know that the mandibular first molars along with the incisors are going to erupt in the age of, they starts at 6 years. In the age of 6 to 8 years, all these are going to erupt into the oral cavity. So now 4 to 5 years cannot be answered. Okay, either it has to be 6 or more than 6. It has to be 6 or more than 6. And the other important key landmark that you have to make a note whenever you are planning to identify these things is crowns of your canines and premolars. Crowns of your canines and premolars are formed around 8 to 9 years. You can see crowns of canines and premolars clearly in the lower half. They are being formed. In the lower half, they are being formed. So this kid is going to have 8 to 9 years. Okay, and whenever your third molars are formed, third molars are being formed, then you can go for a higher raise, but third molars are not there in this particular teeth. So the answer is 8 to 9 years. So this concept is very, very important, and make sure I want you to solve more number of questions on this particular area, because this is one of the frequently asked area in dental anatomy as well as in pedo. Now the next one is again question number 85. Question number 85. I want you to write down this. I don't know whether you have worked on this or not. It's given in your worksheets. So mesial cuspal ridge is greater than distal cuspal ridge, or distal cuspal ridge is greater than mesial cuspal ridge. You have to remember the teeth. So my suggestion is you remember one. The other teeth are going to be opposite. So my suggestion, I want you to remember this. Mesial cuspal ridge is more than distal cuspal ridge in the case of these teeth, two teeth. One is the primary teeth, that is your maxillary canine, primary maxillary canine. Second one is the permanent teeth, that is your permanent maxillary first premolar. That is more talking about the facial cusp. These are the two teeth where your mesial cuspal ridge is going to be larger than the distal cuspal ridge. Whereas the rest of the teeth, the reverse is going to be right. Now the question is, all of the following teeth are presented with mesial cuspal ridge or the buccal cusp shorter than the distal cuspal ridge. Okay, they are telling that distal cuspal ridge is going to be more than the mesial cuspal ridge. Except, means they're asking in which of the following teeth mesial cuspal ridge is going to be more than the distal cuspal ridge. The question. The answer is permanent maxillary first premolar. Permanent maxillary first premolar, which is your option D. Okay, so try to be little logical. Okay, this sequence is very, very important. Again, you have a question on this particular area in 2024 NEET examination. Again, this question can be a smile designing based question, or this question can be a dental anatomy based question. The answer is option D. Guys, I hope we are very, very clear. I want you to make a note of this. Mesial cuspal ridge is larger than the distal cuspal ridge in the case of your primary maxillary canine and in the case of your permanent maxillary first premolar. Whereas rest other teeth where cuspal ridges are there, your distal is going to dominate when compared to that of the mesial side. I hope this is very, very clear. I need a thumbs up sign. So with which we are going to jump into question number 86. Question number 86, they're talking about the 2 cusp premolar. Why? Very specifically, they have mentioned 2 cusp premolar. And I hope like most of you are aware that we have 3 cusp pattern as well as 2 cusp pattern. So premolars with 2 cusp patterns are going to have 2 triangular ridges, and connecting those 2 triangular ridges, I'm going to have 1 transverse ridge. Whereas when I was talking about the premolar with 3 cuspal pattern, which we have discussed, the 3 cuspal pattern premolars, which are commonly seen in the case of your mandibular second premolar zone, I'm going to have 3 triangular ridges, but none of these 3 triangular ridges are going to meet to each other. So that is the reason why in a 3 cuspal pattern of a premolar, I'm not going to have any transverse ridge. So transverse ridge is present only when 2 cusps are present. It is not present whenever there are 3 cusps. But triangular ridges are equal to the number of cusps. 2 cusp premolar is going to have 2 triangular ridges, and 3 cusp premolar is going to have 3 triangular ridges. And I hope this concept is clear. A very frequently asked question. Of course, you have one more question integrated to the same teeth. Okay. Now the question is 2 cuspal premolars are going to have 2 triangular ridges and 1 transverse ridge. 86, the option is option B. Okay, right, chalo. Then comes again a straightforward, easy question. A 12-year-old patient presented with a routine dental checkup. Examination reveals there are some intrinsic horizontal bland-like grayish brown discolorations affecting the middle 1/3 of multiple permanent teeth. The patient's history is significant for repeated antibiotic uses during the childhood for the respiratory illness. Which of the following is most commonly responsible for this presentation is tetracycline. Tetracyclines, we know that they are going to cause discoloration of the particular teeth. The answer is straightforward, easy application based. Answer is option C. Coming to 88, root completion. Again, I myself have discussed this particular concept. Primary teeth are going to take around like 1 to 1.5 years after their eruption for the root completion to be done, and permanent teeth are going to take double the time of the primary teeth. They are going to take double the time of that of the primary teeth. Now the question is, root completion of your permanent teeth is achieved by how many years after the eruption? It is double the time, that is 2 to 3 years. That is answer is option B. The answer is option B. Then jumping into question number 89. Permanent premolar which has often double roots. Okay, most of the premolars except your maxillary first premolar are going to have single roots. Straightforward double roots. All the premolars are given. The answer is option A. Most of the other, particularly mandibular, are going to have single roots. I hope you have done extraction, so it's not a tougher concept. Next question, crowns of incisors when you are viewing incisally, means when you are viewing occlusally. So how the crowns of incisors are going to vary? So they are wider in mesodistal in the maxilla, and they are wider buccolingual in mandible. Okay, simple straightforward question. The answer is option D. Next comes is the centric holding cusps. Centric holding cusps are nothing but they are stamped cusps, also called as supporting cusps. They are called as functional cusp. They are called as. What are these? These are nothing but in the maxilla. These are palatal cusps. In the mandible, these are buccal cusps. Buccal cusps of the mandible and the palatal cusps of the maxilla are called as functional cusps. So buccal cusp, it should be mandible, wrong. Buccal cusp, lingual cusps or palatal cusp, it should be maxilla, wrong. And coming to distolingual, again lingual cusp, lingual means palatal, it should be maxilla, given as mandible, wrong. Whereas mesopalatal cusp of maxillary first molar is called as functional cusp, supporting cusp, stamp cusp, centric cusps. Done. Then comes 92. Again, you have a question. Again, this is a very old question of NEET examination. A little controversy is there, but it's okay. But I want you to check out this. Whenever you have a question like this, tooth erupts at the age of 11 to 13 years. So now you have eruption sequence nicely given here. So let's keep eruption sequence aside and try to write down. So option A, they're talking about maxillary canine. Option A, they're talking about maxillary canine. Maxillary canine eruption is 11 to 12 years. Option B, they're talking about mandibular second molar. Mandibular second premolar. Mandibular second premolar, 11 to 12 years again. Option C, they're talking about mandibular second molar. Mandibular second molar. Mandibular second molar, 11 to 13 years. Option D, they're talking about maxillary third molar. Maxillary third molar, according to this, is 18 to 25 years. Now the answer is identify which is 11 to 12 years. What is 11 to 12 years? 11 to 12 years is option C. So guys, the main motto is whenever you do mistakes, it is okay. You do mistakes here, not in the final exam. You read hard, you work hard, but of course, in the examination hall, there are some questions which require some logics, which require some application power, which require some memory power. So whenever you are practicing, let it be a Q bank you are practicing or a subject specific you are practicing or a GT, the whatever paper I'm discussing is a GT you're practicing, it's okay, you do mistakes, but please do mark the questions wherever you're doing mistakes and try to go a little deep into the particular concept. Whenever such tables are correlated, make sure you go back and try to work on these tables which are there in your workbook, because workbook is the one which we are going to revise in the last couple of days. Okay, and whenever you do mistakes and if you are highlighting them in the workbook is going to tell you where you have to revise more, where you have to focus more in the last couple of days, because I told you there are some areas, not entire paper, there'll be some 30 to 40% of areas which are depends upon the memory or which depends upon the revision, whatever you are doing. So make sure, please do work on it. So because these are going to helpful, and make sure whenever you have classes, particularly question solving classes, it's not about, I'm not talking about basic classes. I'm talking about question solving classes, like this question solving classes you have to attend live. Whenever you attend this question solving classes live, you will get to know how the mentor is approaching towards the right answer, and how you are going to approach towards the right answer. Over a period of time, if you attend such classes, and practicing along with the mentor, over a period of time, over a practice, you start thinking like how he is thinking, because you're going to have, as you're watching this particular mentor classes over a period of time, so both of your frequencies will match over a period of time. You start thinking how he can think, so that is going to helpful for you in the examination. Particularly a single mentor teaching many subjects, they can integrate the concepts here to the concepts which are there in a different subject. That is going to be an extra edge for you when you're preparing for an entrance examination like this, which has integrated approach. So question number 93, again, a straightforward, simple question. Stenson's duct opens. Stenson's duct is a duct of your parotid gland, which opens into your upper second molar. Straightforward question, option A. So then comes, again, this is what I was talking about. So I was talking about the cuspal pattern of your mandibular second premolar, which has a 2 cuspal pattern as well as 3 cuspal pattern. So those are different patterns. One pattern is H pattern, U pattern, and V pattern. And if you check out this question, they have given a U-shaped groove pattern is seen in the case of that is your mandibular second premolar, option C, 94. Coming to 95. No, a question which requires a little more consent to address. The question is, a student is asked to identify the most stable teeth in the human dentition. So I got my answer. Now I need to check out my options. Most stable teeth is definitely going to be canine. Canines are the most stable teeth. Okay. And that too canine, which is having a larger root. So larger root, I have discussed, is present in the case of your maxillary canine. So straightforward, by reading the first half of the question, the answer is A. So now I'll check into the second half of the question. Specimen showing a teeth with relatively larger root. Again, they are also mentioning the same thing, larger root compared to the crown. So it can be either maxillary canine or mandibular canine. If the second part of the question is reversed, for example, specimen which is showing teeth with larger crown compared to that of the root, then my answer is mandibular canine. Okay, my answer is mandibular. Now it is very simple. If you check out canines, both the canines are going to have same dimensions, that is 27 millimeters according to Whalers. And if you check out the maxillary canine, the crown is 10 millimeters and the root is 17 millimeters. Mandibular canine, the crown is 11 millimeters and the root is 16 millimeters. Both of them are going to have same dimensions, that is 27 millimeters. Now it is having more root surface area is more in maxillary canine when compared to that of the mandibular canine is the concept. So whenever it is having more root surface area compared to mandibular canine, maxillary canine will show more resistance. That is the second half of the question also is addressing the maxillary canine. The answer is maxillary canine, option A. But if the second half of the question is reverse, telling that if you compare, okay, the root, it is going to have the longer crown when compared to that of the root. So then your answer should be mandibular canine. But straightforward, first half of the question, second half of the question is directly telling the answer is maxillary canine. Straightforward question. Of course, this values of maxillary canine, mandibular canine, which is having highest crown value, which is having highest root value, is a very, very frequently asked question in the examination. So coming to 96. So 96, again a straightforward easy question. This concept was repeated in NEET 2023. Typical concept. A pediatrician dentist observes the child's maxillary molar that resembles the permanent molar, premolar, rather than the typical molar morphology. what is this particular teeth? What is this particular teeth? This particular teeth is your maxillary first molar. Okay. So, and we have discussed, right? So, your primary mandibular first molar is unique, does not resembles with any other teeth. Whereas your primary mandibular second molar is going to resembles the permanent mandibular first molar. Whereas your primary maxillary second molar resembles your permanent maxillary first molar. And that is the reason why we have discussed both of them are going to have cusp of carabinae. Cusp of carabinae is seen in the case of your permanent maxillary first molar and primary mandibular second molar because they look similar. But only teeth which look very unique is primary mandibular first molar. Now the question is they're asking which resembles. Premolar, which resembles is only one, that is primary maxillary molar resembles the premolar. The answer is option C. Easy question 97. You got a 6-year-old newborn to the pediatric dentist with 2 erupted mandibular incisors at birth. The teeth were erupted at birth. Teeth which are erupted at birth are called as natal teeth. Teeth which are erupted in the first 30 days are called as neonatal teeth. First 30 days. In first 30 days, those teeth are called as neonatal teeth. It is clearly mentioned at birth. Okay, there were few people who are confused, telling that 6 days old. 6 days, yes, answer is neonatal. But you should be very, very clear. The answer is natal teeth. Most of this natal teeth or neonatal teeth, again, a question which is repeated so many times, is your mandibular incisors. Okay, next comes a 10-year-old boy undergoes orthodontic treatment, orthodontic evolution. The dentist noted that the primary teeth are larger mesodistally than the premolars. Primary molars are larger than the upcoming premolars. The difference between those is called as that extra space. The difference between those is called as leeway space. And you know what are the primate spaces? Primate spaces, anthropodal spaces are seen in the case of anterior. Incisor liability is talking about the incisors, right? It is only talking about the incisors. So all these are ortho concepts which are inclined to your dental anatomy. Now the question is, you should be very, very clear about the values of these leeway spaces, which we have discussed in ortho. So maxilla is going to have a leeway space of 1.8 millimeters in the entire arch. Sometimes they're going to ask for each quadrant. So it is going to be 1.8 by 2. Then it is going to be 0.9 millimeters. So you should be very, very clear what they are asking. So if it is mandibular, the leeway spaces are going to be more. That is going to be 3.4. 3.4 by 2, it is going to be 1.7 millimeters per each quadrant. Okay, right? I hope you guys are very, very clear. So now the question is about the mandibular. So mandibular, the answer is 3.4, option B. Then comes next one is question number 99. A 2-year-old baby presented with ulceration on the ventral surface of the tongue caused by the sharp erupted teeth. Caused by the sharp erupted teeth. What is this condition called as? This condition is basically called as rigafida. So this is basically associated with natal and neonatal teeth. Whenever the baby is sucking the milk from the nipple of the mother. So this rigafida is basically causing. This is called as rigafida disease or rigafida syndrome. It is seen on the ventral surface of the tongue. Initially, whenever the baby is sucking, so there was an ulceration which is formed on the nipple of the mother. So long back, rigafida is basically called as an ulceration on the nipple of the mother. Over a period of time, so it is more commonly seen on the ventral surface of the tongue of the baby. So then the rigafida, feeding abnormality associated with premature eruption of the teeth like natal and neonatal teeth, leading to this particular ulceration called as rigafida disease. Okay, right? Application based question related to eruption sequence. The answer is A. Coming to the last question of today's discussion. So 28-year-old patient examined for the occlusion during the lateral movements only on the right maxilla and mandibular canine. So in the right side, so your maxillary and mandibular canine are contacted, whereas other posterior teeth are disoccluded. So you see there is no contact in the posterior teeth, but you see your anterior canines, there is a contact between the canines. This is called as canine guided occlusion. We have discussed in the video. Okay, right? This is called as canine guidance occlusion, which is discussed in the video, with which I am done with today's discussion of 100 questions. So yesterday I took around like 1.5 hour, 1 hour 40 minutes, and today it was around like 1 hour, because most of the dental questions are dental. I mean, like dental anatomy questions are easy and straightforward. Okay. So as I already said, midterm batch of MDS Conquer is going to start from 21st October with a customized schedule. My approach is always very simple. So approach is going to vary from individual to individual. Okay. So basing upon your requirement, basing upon your goals. Okay. So I'm going to give a personalized schedule. So that is my game plan, which I'm following from so many years. Okay. So we have a batch which is starting from September 21st onwards, and you can contact the helpline number 9966 939317, or you can directly register yourself on the website www.mdsexam.com, or you can search MDS Conquer um, on the iOS app or on the Android app. You will be getting, you can register there. So, and the main motto is again, because you need to get a feel towards the final exam, I'm trying to give both website access as well as the app access. App, you're comfortable. Website, whenever you're giving grand exams GTs, I strongly recommend to use website. Okay, big screen are required. I want you to give exams on the laptops. I want you to give exams on the desktops. Try to avoid giving exams on the tabs. Try to avoid giving exams on the phones, because we have website access. Okay, right? So you can watch the you can watch the classes on the big screen also if you're a part of MDS Conquer. So it has both app and website access. So that is an extra edge or advantage you have. So I'm done for today. Okay. So make sure we'll meet again very, very soon. And please do subscribe the channel, one, and please do keep your notification on. Okay. So bell notification should be on, because whenever we are taking live classes, we'll try to drop a notification on the YouTube. If your bell notification is on, you will get a notification, and you can keep a reminder, and you can come and attend the class. We'll try to have so many interactive classes in the next couple of days. Okay. So hope you like the session. Hope you like the video. And yeah, all the best. Take care. Study well. If you have any doubts, anything, you can contact us directly. Direct option is there. Or you can drop a comment on the video box, so that we'll try to help you out.